afternoon, everyone. Thank you for joining us here today for the semifinal round. And I will be clarifying the motion right now. So the motion for this round is telemedicine should become mandatory for all medical services involved in primary care in Thailand. I will now be introducing the adjudicators for this round. First of all, we have Assistant Professor Dr. Sodrat Thamapusadi, Assistant Dean for Organizational Digital Transformation, Faculty of Engineering, Mahidol University. Next, we have Assistant Professor Dr. Adison Ratanayota, Deputy Head of the Department of Anatomy, Faculty of Medicine, Siriraj Hospital. Next up, we have Dr. Jirapat Sopon, Clinical Ambassador at Siriraj Informatics and Data Innovation Center, Faculty of Medicine, Siriraj Hospital. And lastly, we have joining us here today is Assistant Professor Dr. Siripen Pongpaishet, Assistant Dean for Information and System, Faculty of Information and Communication Technology, Mahidol University. So the debate round will be beginning shortly. The debate will now commence.
Attention all competitors, the following are the rules for the debate. Please listen to these rules carefully, they will not be repeated again. In the following debate, a topic will be presented. You will debate within the scope of that topic using the information you have previously researched. Each speaker will have 5 minutes per round, with 4 rounds per team, to present your arguments to the best of your abilities. Should a challenge arise, it will be addressed at the end of the allocated 5-minute round, after which 1 minute is given for the source to be found, and 1 minute is given for the accused to present their case. Please turn your devices to silent and airplane mode to ensure no outside internet connection. If this is not the case, you will be immediately removed from the competition. Any suspicious contact with staff or the audience will be considered cheating and lead to immediate disqualification. Any violations of the previously dictated rules will lead to immediate disqualification. We wish you the best of luck in the following debate, starting with the proposition. You will have 5 minutes, starting from now.
Greetings, honorable judges, esteemed opposition, and members of the audience members. Today, as we move into this age where economic divide is certainly a key part of how well we can deliver medicine as a whole, and how well we can help these patients who are what we call, as we would call them, inadequate in their care. Which is why we, as the proposition, would affirm that telemedicine should be mandatory for all medical services involved in primary care in Thailand. First of all, we have to start with some definitions. Now, what do we mean by mandatory? First of all, mandatory for us is not that we have to use this at all times, but rather mandatory to be implemented in every single hospital, ensuring that this system can be accessed and can be used when the cases are needed. Secondly, primary care is that the first point of contact in the healthcare system where encompassing routines such as checkups, disease management, or preventive services can be accessed within the borders of your own home without needing to go to the hospital. And thirdly, we have to talk about the definition of what we mean by telemedicine, which is, frankly, the remote delivery of healthcare system and clinical information using telecommunication technology. So, with that in mind, what points do we have to support these plans? First of all, is the improved accessibility and convenience that Within the Thailand's diverse geography, spanning mountains, islands, and rural plains that are really, really far away from big hospitals that have everything that they need, we can use telemedicine as a way to bridge that gap and make access easier. And we have seen these cases being implemented already, such as the ones in mobile clinics, such as healthcare booths, and initiatives like 30 Baht Treat Everywhere, according to Thai Ministry of Public Health in 2023. Secondly, we have to talk about efficiency and reduce healthcare burden. By that, we mean that the virtual consultation liberates precious hospital resources. We no longer have the needs for such as doctors to allocate their time into some things that can be easily accessible and easily be communicated to these patients. And we should rather use this technology as a way to focus on other critical factors instead. And it has been implemented before, according to George Washington University in 2024, that AI-powered diagnostic tools into telehealth performs assist frontline providers with early screening, flagging potential conditions for further evaluation. Thirdly, we have to talk about the pandemic-proven effectiveness. Back in the age of when COVID-19 was still in its early years and been spreading every single place, everywhere internationally, including our country of Thailand, we have to talk about the fact that the World Health Organization in 2023 also implemented remote consultation reduced patient exposure to infectious pathogens without compromising quality of care at all. With Thailand's telehealth utilization surged over 300% at the height of pandemic, preventing thousands of potential transmissions within healthcare settings. And to conclude all of this, a national mandate for telemedicine in primary care aligns with Thailand's universal health coverage goals, ensuring and enhancing the patient experience and fortifies our healthcare system. And for that, we affirm to the motion. Thank you.
Thank you. Now we will continue with the opposition. You have 5 minutes, starting from now.
Good morning, honorable judges, fellow debaters, and esteemed audience. As the first speaker and team leader of Code Blue, representing the opposition, I stand firmly against the motion that telemedicine should become mandatory for all medical services involved in primary care in Thailand.
Let me be crystal clear. We are not against telemedicine. We recognize its benefits in specific scenarios, but making it mandatory, making it a default for all primary care, risks compromising one of the most important principles in medicine, which is accuracy of diagnosis and patient safety. The proposition team stated that they wouldn't make it mandatory in every service, just that it should be implemented in every hospital. Yes, but this motion clearly focuses on primary care, specifically saying that it must become mandatory in all of these services. In other words, they are simply going against their own stance. Which leads me to our next argument. Essentially, the physical presence of a doctor allows for far more than just conversation. It enables physical examination, 2, hands-on testing, 3, vital signs measurements, and 4, non-verbal symptom observation, like limping. These are not details, but these are critical diagnostic tools. And according to a 2022 study published in the Journal of the American Medical Association, also known as JAMA, telemedicine encounters were associated with a 15% higher likelihood of diagnostic error in primary care compared to in-person visits, particularly for complex symptoms like abdominal pain, shortness of breath, or neurological complaints. Now, let's do some role playing. Imagine this. A patient reports stomach pain via a video call. The doctor can't palpate the abdomen, check for rebound tenderness, or hear abnormal bowel sounds. That's how appendicitis is missed. A parent shows their child's rash on camera, but lighting, video quality, and color distortion hides crucial image signs. That's how conditions like meningitis gets overlooked. A diabetic patient insists they're fine. In person, the doctor would have noticed a foot ulcer, but virtually it skipped. That's how limbs are lost. These aren't theoretical risks. These are real clinical dangers. In reality, in urban Bangkok, telemedicine might work well, but in rural provinces, many patients still lack stable internet, private consultation spaces, or digital literacy. Poor video or audio quality increases the likelihood of misdiagnosis or patient confusion. For instance, because I study at a boarding school in the US, I do a lot of volunteering remotely through video calls with children who are working in the mountains or blind children in Vietnam. And I can say from personal experience, there's a lot of issues with audio quality and video quality. Now imagine, this is just some tutoring English lessons, but what we're talking about is healthcare. And the issue is that it can cost a life. Additionally, according to the National Statistical Office of Thailand in 2023, 34% of rural households still lack reliable broadband, forcing these communities into mandatory telemedicine. Forcing these communities into mandatory telemedicine may actually create more inequality, not less. An enforced telemedicine policy removes patient choice, violating a core ethical principle of medical care, which is autonomy. What if an elderly patient is uncomfortable with technology, or if a mother feels her child should be seen in person? These choices are stripped away from patients. Patients are forbidden to meet with doctors, which raises the question, what is the purpose of efficacy of healthcare if people's concerns are not being addressed? This defeats the purpose of service, in which healthcare is a service. People must have the right to choose how they receive care. No system should force patients into a one-size-fits-all solution, especially one with known clinical limitations. We oppose this motion not because we oppose technology, but because we stand for safe, effective, and ethical care. Thank you.
Thank you. Now we will continue with the proposition. You have 5 minutes. Your time starts now.
Right. Ladies and gentlemen, esteemed panel and respected opposition. As the second speaker of this bench, I'd like to strengthen my case by clarifying misconceptions that mandating telemedicine in primary healthcare is not just logical, but it's urgent. Now, I agree that it can loss a life, but it also can save one. Let's zoom in, right? Now consider a fisherman in Got Li Bay, a small province in Sulu, near American borders. When experiencing chest pain, the only option is to wait for the boat to make the mainland, which can be delayed by tides and storms. This isn't rare, it's a daily reality occurrence. And it's also one of the phenomena that thousands who live in remote areas also face. With mandatory telemedicine system, that health post could be equipped device that connect them with doctors in Hat Yai. An ECG could be uploaded and a consultation could begin in a few minutes. If the doctor sees early signs of heart attack, a boat or a helicopter could be dispatched earlier, saving precious time and maybe his life. It's not just science fiction, it's entirely feasible. If telemedicine becomes a non-negotiable part of our primary healthcare system, this is the mandated telemedicine levels the playing field. It doesn't eliminate person care, it ensures everyone gets at least some of the same care, when otherwise they might get none. Right, now let's zoom up and look at the healthcare system itself. Thailand public hospitals handle millions of primary healthcare visits per year. Many of them routine of these crowded patients. When you manage telemedicine, you're not just offering option, you're creating a system with wide triage. it becomes standards for low risk cases be screened remotely first. Easing the congestion, doctors waste their time repeating the same consult for flu, skin rashes, or prescription refills. Now, add technology. AI-powered tools are not just futuristic add-ons. They are already being used to flag abnormality in scars, detect early warning signs, and streamline patient history collections. If telemedicine is left optional, these efficiencies remain fragmented. But mandating it integrates remote triage into national care pipeline. So now, let's be real. Opposition may bring up digital access, trust, or equality. But here's the truth. Digital divide, we are not suggesting instant adoption. We're suggesting national standards supported by investment in kiosks, indirect expansion, and community training, like what we already piloted in many provinces. Quality, AI tools now flag early risk better than overwhelmed clinicians can in busy wards. And protocols ensure red flag symptoms still go to hospitals. So, in conclusion, mandating telemedicine in primary healthcare doesn't mean less care. It means smart, inclusive, and future-ready care. Thank you.
Thank you. Now we will continue with the opposition. You have 5 minutes starting from now.
Good morning once again, esteemed judges, audience, and fellow debaters. Building on my team's compelling case laid out by my teammate, I will be advancing the opposition stand by addressing two serious yet overlooked consequences of mandating telemedicine in Thailand's primary care system. One, the confusion surrounding billing and insurance, and two, the rise in social isolation, especially among vulnerable people. But before I begin, let me reaffirm what our team stands for. We are not against telemedicine wholly. We see its value in specific supplementary roles, but making it mandatory for all primary care services is not progress. It is an attempted shortcut, and shortcuts in healthcare are simply dangerous and inhumane. Let's begin with billing, confusion, and insurance inefficiencies, an issue the proposition completely ignores. Healthcare is already stressful and hard to understand for most. Now imagine adding a layer of financial confusion to it. In a traditional clinic, patients know exactly what they're paying for: a consultation, a prescription, and maybe a follow-up. But in telemedicine, the water gets murky. Digital consultations introduce areas for new billing codes, unfamiliar AI-driven service charges, and platform-specific fee structures that most people simply don't fully understand. For example, is messaging your doctor privately billed separately from video call, like how you have to pay to send a specific message in messengers? What happens when one system doesn't communicate properly with your insurance provider? The result of this? Overcharging, underdisclosure, and patients often left in the dark. Let's use an example to make this point clearer. According to a 2023 report from the Healthcare Access and Equity Project, over 1 in 3 patients in Asia reported confusion or surprise costs when using telemedicine. And for low-income patients, these surprise costs could mean choosing between medicine and food. And it's not just about money, it's about the trust. A system that views exploitative or unpredictable pushes people away. And that system, with many holes for large companies to exploit, would most likely get exploited. Because history has shown time and time again that anything that can be taken advantage of for profit would most likely be a victim to that, exactly. Patients would begin to avoid care and healthcare altogether, fearing the financial consequences more than their own citizens, especially the poorest of the poor. And that defeats the whole healthcare system. And here's another tragedy. Even if patients want to access telemedicine, some of the poorest simply can't. This policy assumes that everyone owns a smartphone, has stable Wi-Fi, and knows how to use digital platforms. But what about the millions in Thailand who still live below the poverty line? According to the National Statistical Office of Thailand, nearly 1 in 3 rural households still lack consistent broadband access. For them, this policy doesn't just create inconvenience, it locks them out of healthcare entirely. By making telemedicine mandatory, the system abandons the very people it was meant to serve. Going against exactly what Proposition claimed, their case does not have the utmost interest for people, because the people includes everyone, not leaving anyone behind. Now let's move on to something even more human. Telemedicine can potentially increase social isolation, especially for the elderly, people with mental health challenges, and those living alone. Healthcare is sometimes one of the few consistent social interactions. A report UC Davis has said that over 60% reported feeling more lonely and less connected to their doctors as before. This is not a minor side effect. According to WHO, loneliness increases the risk of death as much as smoking 15 cigarettes per day. Now the proposition might say this saves time and reduces overcrowding, but that may be true for some. But that means connection, clarity, and human interaction to become a trade-off for convenience. Why must we choose between the two groups? Why must it be one or the other? If telemedicine was integrated but not made mandatory, we would have the benefits of both sides. And Prop saying that they won't make it mandatory, only mandatory in some hospitals, is literally going against the motion itself, because the motion is saying that you must make it mandatory for all primary care services. Let's not forget the bigger picture here. Our next speaker will reveal the systematic dangers of this even more. Thank you. Proud to oppose.
Thank you. Now we will continue with the proposition. You have 5 minutes starting from now.
Good afternoon.
Okay, good afternoon, esteemed judges, the opposition, and fellow audiences. Now, one of the strongest reasons why telemedicine should become mandatory for primary care in Thailand is, I'm sure something that we all have experienced before, is the significant increase in cost of living. With today's day and age of inflation and stuff, the cost of living has increased significantly. This affects not only the healthcare system, but also patients as well. With rising medical costs, transportation expenses, and long clinic queues, many Thai patients, especially in rural areas, either delay or avoid treatment altogether. The telemedicine eliminates unnecessary hospital visits for minor or follow-up cases. Instead of spending hours and money to see a doctor, patients can consult online. Hospitals will also save resources by reducing congestion and streamlining basic care services, leading to better use of staff and infrastructure. Telemedicine improves healthcare accessibility, but not at the cost of quality. With clear protocols, trained digital staff, and remote monitoring, we can maintain treatment accuracy while enhancing reach and affordability. For example, according to a 2022 study by the Journal of Medicine, Internet Research, or JIR, patients using telemedicine in Southeast Asia, including Thailand, saved on average of 43% in total of medical-related costs per visit. Additionally, hospitals saw a 25% drop in unnecessary outpatient volume for non-urgent cases. Thailand's own National Security Office, the NHSO, has started integrating teleconsultations under its Universal Healthcare Scheme, or UHC, through projects like Dr. Laksa and Modi. These platforms are already proving effective in managing chronic disease patients, prescriptions refills, and minor consultations. As a result, when telemedicine is made mandatory in primary care, it reduces the overall cost burden, especially for low-income and rural patients. It strengthens Thailand's UHC system by making it more efficient, less congested, and more inclusive. The benefits of convenience and expanded access do outweigh cybersecurity concerns, especially when platforms are government approved and encrypted, as is the case with the NHSO-led projects. Now, I would like to talk about some concerns that the opposition may have. Firstly, the digital divide concern. In cases where digital device may not be accessible, we can use subsidized devices and telemedicine kiosks in community centers, such as PCs in the local public library, that can bridge access gaps for the elderly and low-income family. And I know it might be expensive to give everyone telephones and stuff, but we can slowly adopt it after time, and I think it would be the best path in the long term. Next would be the quality of care and diagnostics, which the opposition has raised concerns. According to the George Washington University in 2024, AI-assisted telehealth tools have demonstrated diagnostic accuracy comparable to in-person triage for common primary care issues such as hypertension screening, respiratory complaints, and skin conditions. Additionally, if fear still stands, a hybrid care pathway can be established. Routine follow-ups conducted virtually with protocols to prompt immediate in-person referral for red flag signs, for example, chest pain or severe abdominal symptoms. Lastly, I would also like to talk about how we have seen the feasibility of telemedicine in history, right? As my teammates have said, during the pandemic, Thailand telehealth usage has surged by 200%, and this was not a temporary blip. It was a proof of concept under pressure. But if telemedicine remains optional, we go back to vulnerability. We delay readiness for the next health emergency, whether it's another virus, air pollution spikes, or natural disaster. Mandating telemedicine builds healthcare resilience, not just for patients, but for providers, hospital, and the entire national response system. Thank you very much.
Thank you. Now we will continue with the opposition. You have 5 minutes starting from now.
Honorable judges, fellow debaters, as the third speaker of the opposition, I will expand on our case by addressing serious flaws in the idea of mandatory telemedicine. First, the dangers it poses of privacy, confidentiality, and data security. Second, the way it deepens inequality by excluding those without access to technology. My first argument, privacy and confidentiality. Healthcare is built on trust. When a patient speaks to a doctor, they expect confidentiality, but in a digital setting, that promise becomes far harder to keep. According to Cybersecurity Agency of Thailand, 2023, cyber attacks on healthcare systems increased by 58% during the pandemic, which telemedicine platforms among the top targets. Let's be clear, this isn't some stolen passwords. This is information about HIV status, mental health records, fertility history, genetic information. In the wrong hands, this data leads to job discrimination, social stigma, and even blackmail. In Finland, 2021, therapy notes from psychiatric patients were leaked. Some were later publicly blackmailed. And let's not forget, not everyone is digitally illiterate. Elderly patients might accidentally consent to third-party apps. Children might access care using shared phones without realizing what data they're sharing. This isn't just innovation, this is vulnerability at the scale. And once you make telemedicine mandatory, you're turning sensitive health into data minefield and the patients into easy targets. My second argument is unequal access to technology, and that deepens health inequality. The proposition says telemedicine gives access to all, but the truth is it only gives access to those who already have access. According to the National Scientific Office of Thailand, in 2023, 34% of rural households still lack stable internet. 1 in 5 low-income families do not own smartphones, So what happens when you make telemedicine mandatory? Poor families are left behind, elderly patients struggle with tech, and rural households can't even connect to call. And let's be realistic, these are not cutting-edge technology. These are very people who rely on most public healthcare. You can't say this policy is inclusive when millions are excluded by the design. You're not removing barriers, you're building new ones, just with better fonts and faster emphasis. To add, the proposition's case is strong. In fact, that can aid most people and still yet can't defend people left behind. The people under poverty line. So, like what my second speaker said, why make it mandatory to just save most when you can integrate it and save all? Clearly our solution is to save all is the better choice. Judges, we're not afraid of technology. We are afraid of what happens when technology is forced on people who aren't ready. Making telemedicine mandatory removes choice, it removes trust, and it removes the very people who need care the most. The people at the north of Thailand, or the people who are in the mountains, who don't have access to internet, or even devices which is needed for telemedicine. We oppose a policy that turns care into a password-protected privilege. Healthcare must adapt, yes, but it must never abandon. Thank you.
Thank you. We will now continue with the proposition. You have 5 minutes, starting from now.
Okay. I believe that we have heard some valuable insight from the opposition regarding the existence of telemedicine that may not be the largest savior that we all need. But let me talk about some key points that I want to highlight, and I would say that are quite detrimental to the perspective of telemedicine as a whole. First of all, one of the opposition said that the existence of lonesomeness in telemedicine has this quote-unquote parasocial relationship, as if you're talking to someone online. Well, I have to agree on that point, but here's the thing. How about we go into a bit of the extreme here? What would be the current solution to this right now if we do not implement a mandate for telemedicine? As we all know, and I think that the opposition would agree on this, that we still lack access to rural areas as a whole, impoverished areas, right? So, if we're not going to put a mandate on this quote-unquote telemedicine, what is going to happen? Well, I have to say, it is going to be quite disastrous. First of all, a mandate. What do we understand by a mandate? A mandate, we put it so that it becomes the center of the attention and becomes the thing that we focus on, and so much so that every other organization are striving to improve upon it to make it reliable for everyone to use it. By making a mandate, rather than looking at it in a point of view that making as if it is something that is inaccessible, how about we flip the script and see it as something positive instead? It's a mandate, so why don't we use it as a force to push this notion that we can strive to one day improve a system that can be accessible to all. Another point that I want to mention is still about the fact that other impoverished places would not have access to internet access. That is still true, but I want to highlight another key thing, is that what do you all think will be the case, the two alternatives to this one? That is to say that we either have to just build it all up from the start, having a healthcare system, or are we going to have a centralized system, a centralized internet access system where everyone can use the laptops or the provided digital devices centralized in that area instead? I think we should come to terms on that regard. And to end it all, I know that it may not seem clear-cut and is still in the gray area of these topics, but I will still have to say that it is within our human nature to find and to improve upon whether we are going to risk putting one step too far or one step too far behind. I would like to have all of you to think about that for a moment. And for that reason, we still affirm to the motion. Thank you.
Thank you, but before moving on to the opposition, we have a challenge. What is the challenge?
I would like to challenge the fact that Prop says or alluded to. He basically said rural areas would collapse or be catastrophic without telemedicine because they don't have access to internet, right? That part we agree. There may not be that much access to internet, but Prop saying that the whole system will collapse entirely without telemedicine, I think that is wrong because isn't that such a far stretch? Basic healthcare facilities still exist in rural countries. They aren't jungles. Take Manongsan, for example. A faraway place, there may be like galians and like, it might not be as developed as Bangkok, right? But there are still basic healthcare facilities, small clinics, small trained physicians and volunteers who go in there and help. So without telemedicine, it would still survive. Is there a citation saying that rural areas without telemedicine would die?
Thank you. Proposition team, you have 1 minute to find references. In this 1 minute, you are allowed to briefly turn off airplane mode to access your already prepared resources. You will not be allowed to use Google or any form of AI tools. Your 1 minute starts now. Now you have 1 minute to elaborate on your argument. Your 1 minute starts now.
Okay.
Test.
Okay. So I would like to elaborate on my I would say outrageous statements about the fact is that the entire structure would fall apart. That is not true. Then I'll have to elaborate on the point a bit. I might have painted a picture of the fact that it might seem as if it's the whole thing is crumbling apart, but I have to elaborate on the fact that in terms of being quite disastrous is that without having telemedicine as a whole, it is true that we still have facilities all over there to provide the adequate need. But with telemedicine, I feel like that connection between the doctors can achieve more rather than not having a way out of it. And with those facilities in mind, I still firmly believe that having not face-to-face, but still seeing the doctors will still have to be better as an alternative. Thank you.
Thank you. Now we will continue with the opposition. You have 5 minutes. Your time starts now.
Good afternoon again. As the final speaker for the opposition, I am here to close this debate by reaffirming one key belief. Healthcare must be inclusive, ethical, and patient-centered, not just efficient or digital. And that's exactly why we firmly oppose making telemedicine mandatory for all primary care services in Thailand. What we would like to elaborate and highlight again is that telemedicine is not an effective measure in primary care. And why enforce something that isn't effective? That is like forcing those who live in extreme heat to use broken fans. Functional, but weak. The proposition gave an example about a fisherman in a remote area in need of healthcare. Yes, I agree, the fisherman can receive a diagnosis from telemedicine. However, that is like receiving answers from Pinocchio, an unreliable source. This defeats the purpose of healthcare, service that is equitable and accurate, especially in primary care. Choice is a fundamental human right. Making telemedicine mandatory is an obstruction of human rights. We agree, Proposition's case is strong in the fact that it can aid most people, but their claims does not defend the fact that people are still left behind. So why enforce something ineffective and has evidently left people behind? Not mandating telemedicine is making it optional, is making telemedicine a tool. For instance, we can use hammers in construction, but we can also use other tools like saws. And forcing hammers in construction take away from the point of construction. More than that, it supports it. This is the case with telemedicine, or with mandating telemedicine, to be specific. Despite the proposition's elaboration on their outrageous claim, it is still misleading. A claim without actual facts and reports shouldn't be claimed at all. In their own words, they said, yes, it's not true. Thus, I believe our challenge was valid. So let's weigh what is truly at stake. Our first speaker, which was me, exposed how this policy, though well-intentioned, creates dangerous confusion around billing, insurance, and trust. The very people in this system aims to serve, which is the elderly, the poor, the digitally inexperienced, are the ones most likely to fall through the cracks. And then our second speaker then touched on something deeper, human connection. Not all healing comes from prescriptions. Sometimes it comes from presence. For many, especially the elderly or those living alone, a clinical visit may be their only social interaction. Then our third speaker warned of two dangerous consequences that the proposition simply cannot ignore: massive data vulnerability and digital inequality. Once telemedicine becomes once telemedicine becomes the default for primary care, private health data becomes insecure. Cyber attacks are rising. Trust is eroding. Let's be very clear, we are not against telemedicine. We see it as its value, as an option, as a tool, as part of a hybrid system that respects both efficiency and empathy. But making it mandatory strips away choice, autonomy, and dignity, which is what we're against. Judges, a good system serves everyone, and that is what is happening and that works against what is happening if we mandate telemedicine. Progress isn't real if it leaves the most vulnerable behind. So we ask you, is speed worth sacrificing treatment and trust? Is convenience worth risking connection? Is digital access worth excluding millions? We say no. And that is why we are proud to oppose. Thank you.
Thank you both teams for their insightful arguments. But before ending this debate, we have another challenge. Opposition team, what is your challenge?
I heard you mention how the telemedicine is ineffective. I'm not going to deny that the system may be at some point inefficient, but I don't think you can just say that the whole entire system is ineffective. Telemedicine is ineffective and it did not help people at all. I think there's a clear difference between ineffective and inefficient. Can you find a source to back that up?
Thank you. Opposition team, you have 1 minute to find references In this 1 minute, you are allowed to briefly turn off airplane mode to access your already prepared resources. You will not be allowed to use Google or any form of AI tools. Your 1 minute starts now. Now you have 1 minute to elaborate on your argument. Your 1 minute starts now.
So at first I would like to elaborate that I never said that telemedicine is inefficient holistically and as a whole. I said that it can be inefficient, and I compared it to a broken fan that is functioning but weak. But if you'd like citations based on the inefficiency of telemedicine, I have some that I've stated in my first argument, which is that according to the Journal of the American Medical Association, telemedicine encounters were associated with a 15% higher likelihood of diagnostic error. I never said that telemedicine is ineffective and is completely not functional.
And she also said it's ineffective in this case, which is basically what we're arguing for. It does not need a whole citation to back it up. It's our opinion, and it's what we're arguing about. But we'll show the citation to the judges, I think.
Thank you. We will now invite our esteemed judges to provide their feedback and comments.
Okay, thank you very much for participants from both sides. Everybody saw the panel from Department of Anatomy. I think both teams did very well in these debates, and both teams also provide many factual knowledge about whether you support telemedicine as a mandatory for primary care in Thailand, or you oppose this or not. I would like to say that from the proposition, the prop team start from Chouan, right? Okay, you open the section very well by trying to set a definition that is like make you be more advantage in explaining your point to the audience. And you also try to raise the issue that is very important, why the telemedicine is very necessary in Thai medical care. And this is one thing that is very nice. Another thing, maybe on the opposite side, is that I think because you are the first one to present your information, sometimes it might be very difficult to adjust to the environment. And also you prepare many script, many information, and you tend to read from the script rather than trying to make eye contact. I'm not sure whether you like to make eye contact to the judge, to the audience, or to the video. Okay. It would be better if you try to improve the eye contact with the audience, or listener, or even the judge, or the opposite team. That would be nice. Okay. As we using this style in the debate, we try to present our content. We try to use our style to persuade the audience, and also we need to use strategy how to persuade effectively, something like that. So it's not just only for explaining the fact. You set the definition, you try to make the explanation in your point that is very well, trying to use more strategy to persuade. Okay, for the second person from the proposition side, method, right? Method, okay. You also try to give examples of why the telemedicine is important in primary care knowledge. One thing that I would like you to add more is that you may want to acknowledge the point from the opposite side first and try to answer whether you agree or not. If you don't agree, you can acknowledge and then refute to that. And also try to add your points to during the debate. Okay. One thing that I noticed is that on the very end of your talk, you try to use rule of three, meaning that you try to give example for 3 examples for ending. Now, you may not recognize of this, but normally when you may notice that many people when they debate or giving explanation, giving opinion, for example, Pita Limjaradat, for example, he usually uses rule of 3 in explaining something by give example for 3 examples, and then stop of that. So the number 3 is very nice for people to remember and also to emphasize everything. So this is the good part. For the third one, not Bavin, right? Not Bavin. You try to emphasize on reduced cost of living, right? And also try to explain that by using telemedicine, you can reduce unnecessary visiting. This is good point. You also give example, give citation in this case. One thing that you can add more in this case is that you can try to explain like how exactly reducing unnecessary visiting to the hospital can reduce cost of living. And on the opposite way, how do you think that telemedicine is not increasing the cost of living? If you can explain in 2 sides, that would be more convincing for the audience. Okay. For the opposition team, start from Patida, right? Patida. Okay. You also give definition and also give example with citation in real world situation, and also try to explain more in your points. One thing that you can add more is that you can, you can acknowledge the opposite idea and also try to explain. Before, after that, you can explain more in your issue. That would be also nice. For the next person, Rattamon, right? You are really on fire. Okay, so there are several strategies using within debate. And one thing is the e-thoughts, meaning that you can share your emotion with the audience. And also for the opposite side, you did it very well. You try to make the audience have shared emotion with the topic. And also, you try to kind of compromise the policy, I think. That you said that it's not on the extreme side that everyone should use the telemedicine or not use telemedicine, but how to find the consensus between both 2 sides, as I understand. So this is also a good point. Also, you mentioned several issues in this debate that make audience to think about that. This is also a good point. For the third member, Kim Yada, right? Kim Yada, okay. You can be more confident in your explanation. You said several issues before starting to explain each issue respectively. As I mentioned, if you say issues and then you add more confidence in explaining, of course, some terminology may be difficult to pronounce at first, but if you try to be more confident, then the audience will believe in your knowledge, something like that. Okay, so I think that is overall, both teams did very well. It's just subtle difference that can make you different between each other. Okay, thank you very much.
for a very beautiful speech for both team. I think I'm very enjoying listening to both sides, and both of the team have come up with a very good arguments with the citations, and we can viewing and follow both sides, right? However, at the end we're going to have some winners, but don't feel sad about that. Alright, it's just the debate. So, but overall we did very good. On the part that I like from the opposition team is like they have talk about like Thai and have some example about Thai cases, which is pretty nice. However, I thought that sometimes you repeat the citation on the same thing. Maybe you can find variety of citations. I feel like you repeat like almost everyone has the same citation on these things, right? So it can repeating things, and then but overall still enjoying. And like for the leader, like we feel that his emotion about the topic very much. But for the rest, I think you can also like get some from him, have some emotion feeling about that. Feel strongly like attached with the topic. You have to trust your judge. I know that you have to study on both sides, right? From what I heard, every group have to study from both sides. So I believe that in your mind you have like, yeah, it can be that way. It's always it can be that way. But when you are in the stage, you have to strongly believe on your position. This is what I believe. In your head, you might have some like opposite already, right? Yeah, but you have to strongly believe on that. And I think from your team, you can bring a lot like what happened right now in Thailand, in the medical in Thailand, and what will be better if we make it mandatory, right? How that things, when things become in the law or it become very in our front, it can lead it going further, better, and so on. So I think that can be a very strong point that you can read. But overall, still good. I love it very much. For the opposition team, yes, I like it very well as well. Everyone have a feeling enjoying on your topic, and I think your team always like listen to this group, and you always have like a feedback, yeah, about what they say, and then do you agree or disagree? How you can handle that? So that is very good point for debating. So we had to listen right, to another team as well. And there are a lot of arguments, a lot of citations as well, and bring in several kind of topics that people might not thought about it. People might love technology, or people love want to use technology, but sometimes we forget that there are several things behind that as well. So from what I heard, like, oh yeah, we haven't thought about that, like insurance, social isolation, and so on. So several kind of things there, especially the trustness, right? The medicine is trust when you see the face and so on. So yeah, I think you can make really strong point, and yeah, but anyway, I feel like it can be better as well if you can add something related to Thailand more. Yeah, so the statistics or maybe some citation is maybe from other country. How about the Thailand? What are we in the state that we are ready to like bring in all the telemedicine and so on, like make it more clear on the Thailand environment. Okay, that overall. Thank you very much. Very enjoyed.
Okay. Both of you done very well and good. I just based on I know nothing and I just based on I know nothing, and if which team can convince me to believe, and both you done well. I could believe both of you, but some challenge is made major of it. Both you that will be challenging. I love it, and I appreciate your time that you spend to research, both of you. You tapping into the debate situation, and you read the drama that very well, that's good. So what the topic are talking for, and in the end maybe this only team to take the point for this thing, right? And just power yourself, everything good.
must say I'm truly amazed by what I witnessed today. To say high school students engage in such a complex, human and forward-looking issue in this level of insight is not just impressive and inspiring too. Okay. Today's debate was not just a clash of opinions. It was a meaningful dialogue on how we might shape the future of healthcare of Thailand. The proposition argued that telemedicine should be a national standard. They show how it could save lives, improve accessibility, reduce costs, and create more equity, especially for those in remote or underserved rural areas. And they remind us that using technology doesn't mean provide less care. It's providing better, faster, and fairer care. The opposition raised crucial concern that trusting doctor, trusting privacy in human presence still matter deeply. They highlight cybersecurity threat, data breaches, hidden infrastructure costs, and the risk of leaving vulnerable people behind. Most powerfully, they remind us about the something machine can't replace: possible physical empathy. The presence of doctor, the comfort of human touch, and the shared space where healing begins. What's clear from both sides is that it is not a battle between innovation and protection. It's a design challenge how we build a system that give us both innovation, both productivity, and both protection and human care. It should not be a zero-sum decision. It should be a positive sum future. And let me say this clearly: the answer won't come from my generation. It's belongs to you. Thank you very much for today.
Thank you, judges, for your feedback and comments. The debate has now ended. You can take a breather and rest your mind while we await the results.